So this is a lymphoma panel, tube number 1, and as you can see, I'm now moving the gates for the DIM45, the monocyte tube, and now the lymphocytes. So this patient has follicular lymphoma. So this is the forward scatter gate. So this is going to break down your cells. And this is our primary gate. So we can see that this patient has a large portion of DIM45 cells, which could be blasts or hematogens. So this is inside our primary gate. These are the granules, and then we're going to have our monocytes and our lymphocytes. So I'm just adjusting the lymphocyte gate here, and now I'm going to put all these in the DIM45 gate. And it should change the color. So on each tube, we have different color priority sets for different antibodies and different gates. And DIM45 on this tube is showing black, but the top color priority is CD19. As you can see, this patient has, most of all the cells are CD19. So I'm going to increase the resolution and I'm going to gate it appropriately. By increasing the resolution here, I could separate the negative from the positive populations. It's a lot easier to see once it's a higher resolution. I change it back so when it's printed out, you can see it. Here's the side scatter versus CD3, so you're going to get a total CD3 off of the primary gate. So for this particular patient, has something abnormal. We could tell that by the DIM45. And so now we're going to look at the other antibodies and other plots. I'm just going to mess around with the gates here, make sure everything looks right. Make sure the lymphocytes are actually separated from the DIM45 population, which they are, and you can see there's a little separation. And right off the bat, once I started running this tube, I knew that this was abnormal. So what comes to my mind once I see populations like this, are they blasts? Are they CD34 positive, CD33? Like, is it myeloid, lymphoid? And we're not going to be able to find out until later on, but we are going to see the different antibodies that that population does hold based on the colors and different antibody distinctions. So I'm just looking everything over, and we're going to check out the other histogram plots here. So we have our CD3 or CD19, and we see that CD19 is very positive, and it's mostly in the DIM population. Here's our CD7 versus CD3, and we're supposed to have a nice streak downwards. It's not too abnormal, but we know this patient already has something going on because of all the DIM45. So they're not going to have too many T cells. And that is it for tube number 1. On to tube number 2, we're not going to have to mess with anything in the primary gate because it carries over from the last tube. This is CD20, and CD20 and CD19 should match up pretty close to each other. And we can see that CD20 is more bright than CD19 was. And that's normal in some patients, but this patient also looks like they have 2 different populations, or it's just streaking out. So I'm just going to gate it appropriately, not going to mess around with it too much. Now this is a very important part, and once you see something like this, you know there are things that need to pop into your head. Once you see this, you should all automatically assume, is there a 1910 kappa lambda that was ordered, or was it the regular 19.5 kappa lambda? Because you're going to have to run it, because these are going to have a malignant light chain possibility. Going back to the colors that I mentioned in the previous tube, the CD20, CD10 population is going to be the most dominant population for colors in this. There are a few lymphomas that you can think of right away that are 1910 positive, 2010 positive. Diffuse large B-cell, follicular lymphoma, and Burkitt lymphoma are the most common. This is going to be tube number 4. I didn't make a video for tube number 3 because it didn't have anything really positive except for the CD19. We've already seen that. So now, just mess around with the primary gate again. Sometimes different tubes move it just slightly. I want to get everything right where it is. So this tube is going to be with our 4:8 ratio, and we're actually going to be gating what I talked about in the slideshow earlier. Here we're going to gate our CD3 just like we did in tube number 1, but we're also going to base our other histograms off of this gate. So here we're going to see CD3 versus side scatter, but it's also going to exclude everything that is CD3 negative. So 44% of his lymphocytes are CD3 positive. So now we're going to go check this out, and you can see the color variation here too, because everything's going to be based off of different gates. So again, 44%, make sure everything looks correct. There isn't too many T cells, but the amount here, you're going to be able to distinguish which ones are CD3 negative, CD3 positive. Here's going to be our CD56, which is gated off that same gate. So 43% of his CD3 positive cells are CD3 negative but 56 positive. And here we're going to go to our 4:8 ratio tube. And I'm just going to move around these gates. They are going to change the colors if I don't gate it correctly. And you can see that they are two distinct populations. We don't have a double population or a negative population, which is good. And that's it for tube 4. Now we're going to go to tube number 5, which is going to be our blast tube. It's going to have CD34, CD33, and CD10. And we can see that the dim population here does not have any CD34, maybe 0.1%. So we're just going to gate it appropriately, make sure we pick out any populations that are showing. And here we're going to go down to the CD10. You can see there's a little bit that's dim. I am going to try to capture it as much as I can. I'm going to increase the resolution again so I can make out the positive from the negative population. And it's going to be a small percent. And we already know that it is 10 positive. So it's not too much of a big deal. But there is a population there that is positive. So I'm just going to move it around, get as much as I can without going into the negative. And you can adjust the gate as much as you want. 11, 12%, that's a lot of CD10 actually. And that's it for tube number 5 in the lymphoma panel.